Okay, so Mark, thank you very much for taking the time to be interviewed this afternoon. As I've explained, this takes the place of a departmental staff survey. I've got 5 questions for you, which you haven't seen, so if you could just answer them as openly and frankly as possible, that would be fantastic. You are being recorded, so good language, please. First question is, why do you do what you do?
Why do I do what I do? Okay.
Maybe you should explain what you do first, actually, because you are in a new role now, aren't you?
Okay. So my role has changed from head BMS for haematology, caretaker manager as head BMS for chemistry, and now head of pathology transformation. So I think everybody would realise that we've been merged with QE. I say we, beg your pardon. HGS has been merged with QE for 2.5 years now, and in some respects we've made some headway into that merge, but in others it seems that we haven't really. So there was an obvious need for somebody to try and push that along a little bit. So my role is to look at some of the projects that will help the combined departments work closer together, offering the best service we can to our patients, and that is what I'm trying to do.
Okay, so thinking about any aspect of your career, either what you're doing now or what you've done previously, what are you most proud of?
What am I most proud of? I think this is by no means, I don't want people to read into this, but I think prior to the merger with UHB and the QE, I think haematology and blood transfusion going back 2 or 3 years, I'm not saying it isn't now, but I was very happy with the department. We've got a good team of people working in the department. We'd been through a merger with Good Hope prior to that, and to be fair, I think any merger you lose people. It's a time for people to review their own sort of personal, you know, their outlook on life, what they want to achieve, and we lost a lot of people in that merger. We were at quite a low level of staff for a number of years, but I think myself and the Band 8s and the Band 7s, I think we managed to build up quite a strong haematology team, and I was quite happy the situation that haematology at HGS was in prior to the merger.
Okay.
I still think it is quite strong as now. You can take that out. It is, but you know,
we'll do some fantastic editing, Mark, to take out all your backpedaling. Don't worry.
Mergers, it's naturally, it will cause people to review what they want to do in life, and you will lose people because of it. That's
no,
not a bad thing.
I thought you were going to say you were most proud of clearing the backlog and working with me last year in biochemistry. So that's somewhat of a disappointment for me.
Sorry, that was the second
most proud moment. So on the flip side to what you're most proud of, what frustrates you currently?
I think what frustrates me, I think the NHS is known to be slightly bureaucratic. I thought we were I thought things were getting better. Now I'm not so certain. It just seems that you have to jump through so many hoops to get things done. I think the people working sort of at lab level don't always necessarily understand the things that we have to do to make changes, and I think they get slightly frustrated because it looks like we're not doing anything, but actually we're doing an awful lot, and it's just not particularly well understood what we have to do. So that frustrates me. Okay,
obviously we're in a particularly unusual time at the moment. So you can either answer with respect to COVID, or, you know, if COVID wasn't here, how are you feeling about the next 6 months?
Honestly, terrified.
Okay.
Terrified.
But I think it's good that you say that, because I'm sure there are lots of people in the lab who think that people of your grade aren't terrified. So I think it's really welcoming that you're honest and say that you're terrified as well.
Yeah, I think, and I was only saying this actually this morning to another member of staff. I think if you look at what we've had to do in the last 6 months, if you 12 months ago you'd said this is what you've got to do, I don't mean me, I mean us as a department, this is what you've got to do over the next 6-12 months to get through the next 6-12 months, I think we would all have said that's absolutely ridiculous, we can't do that. But do you know what? We have done it. We have done it.
Yeah.
It's been very tiring. And I think I, like many other people, are probably mentally and physically exhausted. And the thought of having to go through this again now, it does terrify me. But we've done it before. We can do it again. We'll be fine.
Absolutely. And so the last question for you. If I had a magic wand, what would you like me to fix?
Right, okay. Let me think about that. What I'd like you to fix is my parking at the Queen Elizabeth, so that I don't have to walk a mile every morning and every evening. That said, it does keep me the svelte person that I obviously am. But being serious, that was slightly serious. Being serious, I think I would like people to understand, and I always tell people that when people are leaving this department, I'm not sure whether this is you fixing something, but when people leave the department, I always ask them, are they sure that they're doing the right thing? And if people are leaving for a promotion, they're leaving to move somewhere else in the country, I've absolutely no problem with that. If people are leaving just because they're going somewhere else, actually, as a trust, as a pathology department, you're not going to go anywhere else really where you're going to see anything more than what you can see at UHB. And I would like you to fix the fact that people need to see that what we've got here, although it might not seem great at times, but actually this is not a bad place to work, and we're a good group of people, and for their professional development, this is a good place to work if we all stick together.
So I would agree with you there. Having worked in many different departments around the country, it's exactly the same thing, just different faces. So I think that as managers and senior leaders, it's our job to speak to the people who maybe haven't worked elsewhere and not tell them, oh, the grass isn't greener, but then maybe make them feel better about the way that they feel working here. So it's not necessarily telling them that, you know, they'll feel as rubbish as they'll feel as rubbish over the city as they do here, but actually make them think, well, actually, I'm really happy and I want to stay. So maybe that's what we need to fix.
Yeah, I totally agree.
Not fix their perception of what it's like elsewhere, but fix their experience of what it's like here. So maybe that's what I could try and fix.
Yes, please. Thank you very much.
Okay. Well, thank you very much for your time this afternoon. I'm going to stop recording now.
Okay.
Oh.